Good morning. We're gonna start live streaming. We will review radial nerve one more time before we go to lower limb. So today I have AJ, right?
No.
Oh, Divas.
Yeah.
I'm sorry, Divas Mod. You know what? We all covered each other, so okay. Can we see?
Yes.
Oh. Can you guys see me? I'm not so sure it's. I think we are on, right? Actually, I can go to. Yeah, we are on. So. Okay, I'm gonna start. Divas, you sit here. We're gonna go over one more time radial nerve. You wanna sit in the chair, whatever you makes it
sit here?
comfortable. Yeah. So. Oh yeah. Today actually we changed the room because since we're gonna do low limb, we moved to examination room. So let's go over because I uploaded the radial nerve since last night. So you guys can actually review my PowerPoint slides. But we will start with I'm gonna just show axillar. I don't need to go axillary area. So this is the axillar. Radial nerve starts from here and it goes posterior part, and then actually you can see this area is gonna be triangular interval. Triangular interval. The proximal part is the teres major, and then humerus. And another one is what? Long head of the triceps makes the triangle.
Yeah.
And then when radial nerve passes this triangular interval, radial nerve is going to go to the posterior part of the arm. And then radial nerve comes between the long head and medial head along with the deep brachial artery. Deep brachial artery. So let's start from maybe. So left side of screen is gonna be, can you guys see well? Left side of screen is gonna be the, let's see, looks like, yeah, see, you can see in the middle, that's the radial nerve. Can you see it? Yeah, that's the radial nerve. And then spiral groove. So you can follow the radial nerve along middle 1/3, that's radial nerve is going to be in the spiral groove. Let's change the gain so you guys can see better. Right? Okay, so here we found radial nerve in between the long head and medial head. And then maybe we talk about the deep brachial artery. Can we look for the deep brachial artery? Let's use the CF, color flow. Move to the radial nerve area. Okay, coming from here. We're kind of lost. There's a radial nerve coming over there. It should be in the bone area. Where did it go? I kind of lost it, right? It was from here, right? So you guys can see the radial nerve on the bone. It's moving. Oh, I think I'm having trouble, which makes sense because we never went to posterior part. And then if that is hard, we're gonna come from the elbow joint, which is our home base. You can, the Divas radial nerve is beautiful, right? There are two nerves you can show. Proximal one is the superficial branch, lower is the deeper branch. There are a couple of branches here. Radial nerve supplies brachioradialis, extensor carpi radialis longus and brevis before it becomes deep branch. So I'm gonna move to proximally. Proximal. So here, if you guys look at Diva's elbow, I'm in the about 1/5 above from the elbow joint, right? Here you can see radial nerve in between brachialis on the right side, and the left side is brachioradialis. Yeah, that one. So now I'm still in the anterior part of the arm. I'm gonna move proximally. My transducer is gonna go to posterior part from about 1/3 from the elbow joint, proximally, and then look at this radial nerve is going to. Okay, now this is in between triceps and biceps. Now radial nerve is going to the posterior part. Yeah. Here. So they're going through the bone, which is spiral groove. Okay. It's moving fast, you guys can see it. Going up and then moving backward. Now it's gonna go to triangular interval, right? So here, now I'm coming back to front part of the forearm. Here already, I'm in between brachialis. So let's say good morning. Now here you can see radial nerve in between brachialis, brachioradialis. You clear? Okay. And then we are practicing the radial nerve in the posterior part.
Wonderful. I actually ended up. Are we online?
Huh? Yeah, we're on.
I actually ended up watching it at night because I was.
Oh,
up
you were
all-
watching?
I was up all night. So
I know.
ended up
I
watching-
slept maybe 3 hours.
Like,
So-
if I close it.
That's good. Yeah. So now I'm in the 1/5 of elbow up, and then I'm going downstairs. I'm in the elbow joint, which is our home base. So you can see now we can change the depth, right? Here, Ivas is very healthy man. So let's take a look the proximal one, superficial one. Superficial branch, that one, if I go up, it's very hard. I never done it. So here we go. Okay, we have to go downstairs now. Superficial, proximal one, follow the proximal one. So now look at this superficial one here. That one is in between brachialis and extensor carpi radial. Can you freeze here?
Okay.
Okay. Oh, you put the cursor there. So this is the superficial one, right? So this is the brachioradialis. This is the extensor carpi radialis.
Okay.
In between, this superficial branch is going to go up, like continuously follow this between two muscles until it comes through the superficial area, which is a 9 centimeter from the radial styloid process.
Okay.
So otherwise, in between the muscle. And then later, when it comes this much, do you guys see it? Radial styloid process comes about 9 centimeter from this part. The superficial nerve is branch comes out to the skin area, surface area. It goes to the anatomical snuff box, and this supplies to 1, 2, 3.5. Right? So now we clear. So let's. Okay. Oh, we made a mistake. I was going to. Here we go, right? You see between the two muscles continuously? Yeah. So that's the superficial. I'm toggling. Yeah, good. And then let's see. Oh, now it's the skin area, right? You see? Can you move the cursor? On the right side. The little, oh, that one. and then it's gonna pop out to it's moving, right? Coming out. So look, let's take a look now. My transducer is in the above 9 centimeter above the radial styloid process. And we follow continuously now in the subcutaneous area. Let's go back. Oh, you kind of lost it, right? But we'll find out. We'll from here, home base again. We move. Am I losing it? I'm not losing it. There it is. The little corner, yeah. Corner.
Yep.
It's going deeper though. Oops. Oh, still over there. Still, yeah. It's coming out now. Still there, yeah. Still there. Now it's popping out. Toggling. Then it's going to be hard. It's very small, right? So there is, maybe we freeze it here. And then don't touch, oh yeah, move, since we hit this one. Then now you can confirm. Can you hit over there? A little top, yeah, the dark one, yeah. Yeah, it's gonna come out, and then as they said, at the wrist, where the wrist is. Oh, I can't. It's so hard. Cephalic artery. We have to find the cephalic artery, right? Can you find it? Here. This is going to be first and second here. Can you find the cephalic artery?
I'm gonna move it.
Or maybe
the computer because Dr. Zizi says
she cannot see it.
Yeah,
The hand is going to be tough.
because of the way your body
Okay.
is. This
You
should
need
be
to fold it
better,
down a little bit.
right?
I think.
Yeah, there you go.
Yeah.
Can you move the color? Can you push the color flow? And then move over there. We'll find the cephalic artery. Oh, it's so hard. Looks like that one, right, to me? Yeah, that area. Underneath is the nerve. We can freeze away here. So it looks like this is the cephalic artery, and underneath this one. Well, we are not so sure at this time, but that area
Yeah.
between the first and second compartment. Okay, then we're gonna unfreeze, and then we go from here. So I'm sorry, left side of the screen is the kind of lateral side. So now you guys can see two nerve. I'm gonna come to the deeper branch, right? We follow the superficial branch. Deeper branch is gonna, as you go down, now you're gonna ask your patient to put their forearm in pronation, right? Because it's gonna move to anterior, going back to the posterior part. So coming here, home base. Now we're gonna go radial. Also, it's beautiful. That one. So I'm gonna move posteriorly but distally. So still, this is the deep. We didn't call deep branch yet, right? Because it has to go to.
Yes.
That's the arcade of Froschi. That one, right?
Okay.
So look at this. It's going into supinator. Here, can you freeze? Yeah, now you can move. Yeah, that one. So cursor. That's the one. Yeah. This point was starting point. So we're gonna double check so that you guys can follow supinate the radial nerve along the supinator, right? Inside of the supinator, I'm sorry. Okay, let's go back. And then deeper branch, let's follow. I'm moving my transducer to the posteriorly, but distally. So I'm gonna go a little more distally. So now look at this radial nerve, follow the radial nerve. Now starting point here, dark round dot. Yeah, that's the arcade of Froschi. And then, see, look at this. Radial nerve is branching out between two heads of the supinator, right? And then, still, this is not posterior interosseous nerve. This is the branch of the radial nerve.
Okay.
Then when it exits supinator, it becomes PIN. Some books says this is PIN, but mostly PIN is after radial nerve exit supinator.
Okay.
So now I'm gonna move Diva's forearm to posteriorly. So here, this is the extensor carpi radialis longus, supinator, and radial nerve, right? The branch. And then I'm moving to posterior part, but distally slowly. Do you remember I said square shape of the muscle is gonna be EDC, extensor digitorum communis, in the middle, right? Square shape. And then now the radial nerve is exiting. See, exiting out from the supinator, which means look at the forearm. When it exits, the transducer is about between the 1/4 to 1/3. So you can still see supinator over there, right? But first muscle, Divas is asking me, why don't you freeze? Okay, so here, this is the EDC, right? Sensitive term communis. Supinator is still there because you can see radial nerve is here, right? But something is popping out in between interosseous membrane and radius and ulnar side. Something is popping out, right? That's not supinator. That's APL. Abductor pollicis longus. Origin is what? Three places: radius, ulna, interosseous membrane. That's why initially when the deeper muscle, deep extensor muscle pops out, the first one is APL.
Okay.
So still you can see supinator here. When you see, look at this, I'm going back there. Let's go back to supinator here still, right? Look at this supinator. I'm moving posteriorly, and that arrow, put the arrow in the APL. Yeah, arrow is popping out now.
Yeah.
As I bring it down, supinator disappears. No more supinator. Right, this is all APL. This is all APL. And if I move down, there's in the corner, some muscle, round muscle is popping out. EPL, which is the origin is ulna only. That's why you see EPL popping out now. That one, yeah. So here, so radial nerve pop exited supinator, right? And then now radial nerve. Let's go back to supinator here. Supinator exiting now, exiting. Then moves in between the supinator extensors and deeper extensors, right? What did we learn? PIN supplies 3 superficial one, 3 or 4 deeper one. So 3 means EDC here on the right side, minimi in the middle, and then ECU. You wanna freeze here? Yeah. Here. So yeah, this is the EDC. This is round one is EDM. This is ECU. And in between, this is the EPL, this is APL, but you guys can see this dot at the radial nerve.
Okay.
So PIN is there.
Okay.
This PIN is gonna go to posterior interosseous membrane, right? So run through that area to go there. This one, PIN is going between the EPL and APL. So diving into the posterior interosseous membrane, that's why it moves away from the probe. That's why you cannot see well.
Mhm.
So we're gonna try to see it. Okay, supinator. Nerve is exiting now. Supinator is gone, right?
Mhm.
So now this only APL. As I move distally, EPL popping out,
It's higher.
right?
Mhm.
And then let's now pay attention how we can follow the PIN to posterior interosseous membrane. Okay, going back and forth. Can you guys see? Sometimes we very hard. I think that could be the one here, in between the EPL
Yeah.
and APL.
Then it goes up.
Now I'm going downstairs. Very hard.
Yeah.
You wanna practice?
Sure. We'll start at the home base. That's here.
Okay. So that's the superficial branches. If
Yeah.
I can help.
Sure. So now I'm going a little bit kind of like to the radial side. I'm just gonna try to follow the superficial branch first.
Okay, superficial one is this one. Follow the superficial branches in between the brachialis and ECRL. Here still we see it. We see it here. Okay, continue. Continue, follow that one. Here still.
Yep.
Follow. Still follow. It's going close to the superficial area. Oh, beautiful. Okay, toggle one more time. Here we go. Toggle. This. You can do wagging too. Okay, follow here. Here. Actually, this time we follow better here. 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 This one. This. Continue going to the subcutaneous area. There we go. Bam.
Oh.
Let's take a look. It's in between
Yeah,
about. Her case is about 5 centimeter above the radial styloid process. So that's heading to the anatomical snuff box, right?
Yeah,
Good
the
job, guys.
first. Okay.
Then
now
let's
we'll
follow
do
the deeper branch.
Let's start here.
Yeah. I'll start. I'll take the
Okay, now I'm
Nice.
gonna show this is the deeper branch. Okay, let's go to go.
And then I'm
Now
gonna
you
ask
can
you
see
to
3
throw
dots.
it a
1,
little
2, 3, right?
Hmm?
So
Okay.
okay, follow.
Yep.
Follow. Now supine. So when you follow radial, oh good.
Yep, so
So
now it's
let's
deep.
find out arcade of here. Go back here. Go back here a little bit. So this is the arcade of here, just coming in now. Okay, entering the arcade of here. Then in between the two head of the supinator. Now it's gonna exit. Exiting the supinator. Continue to move to
Sorry.
ulnar side to distal. So look at this exiting. Almost. Look at this. Now, when supinator is almost gone, APL popping out, radial nerve is going into here. This is the radial nerve
Mm-hmm.
above the APL.
APL.
Right? Good. And then move down continuously. You can see
And then the
two
APL.
branches.
Yep.
Yep. It's so posterior interosseous.
Yeah,
And
yeah,
then
look
here
at that.
see 2, 1
Yep.
and 2.
Uh-huh.
And it's going
I'm going
into
up and down.
interosseous membrane here actually. So the posterior interosseous nerve is in between the EPL and APL going to the posterior interosseous membrane.
Right.
Actually, we
because
saw it
EPL
here. Yeah,
is
here.
to the left.
Okay, go up and down fast, a little faster so you can.
Yeah, the left.
We were able to see AIN much easier than PIN actually.
I think it's because of the positioning.
Yeah. Okay, now exiting supinator. Oh, good job. Okay, continue. Continue now. APL popping out. Radial nerve is here. And then distally, move your transducer distally, then EPL popping out here. And then posterior interosseous nerve going to the
This time it didn't
here.
see
I
it so
think
well.
you have to go up and down. This time it's hard. Previously we were able to see it. You have to go radially
Yeah.
and then distally. Oh, you're following
Yeah, because I
the radial nerve. Okay, good job. Sorry. Okay, moving now, coming out.
it was going away from me. Okay, now.
Okay,
good.
now
Yeah.
clear. Okay, now you can distally, go distally. So this is already a nerve. 1, 2. And then you have
And now it's
to move a
dying.
little fast.
I think that's one. You see one of them going down in the
This
middle.
one right
Yeah,
I see it actually. This
The
one.
other, yeah.
This one.
Yep.
This one. Yep. Because it makes sense in between the EPL and APL.
Yeah.
And going to the interosseous membrane. I think here.
Yeah, actually.
You
yeah.
see here, right?
Yeah,
You
yeah.
can see it here.
Uh-huh.
Okay, now go straight down to fourth compartment. Follow this nerve. Are you moving distally now?
Yeah.
Yeah, okay.
Just so you're not moving.
Maybe you want to stay over there. Let me use color flow. Just wait a little bit over there. Can you toggle a little bit? Oh, it's very small.
Oh, there.
Looks like that area, right? This in the middle with our cursor. This area is coming. Oh, now I see it here.
Yep.
Wow, it's beautiful. Okay, did you see it? I'm the only one who saw it. It does make
Yeah,
sense.
no, I also.
Okay. Okay, very good. So, okay, let's continue. Continue down to wrist.
No,
Force
no,
comfort.
that's where I'm losing
See
it.
here, see?
And then you see I'm going to I kind of see.
Oh, cursor.
But then is it going up? Is it going more superficial afterwards?
Yeah, now you're going to the tendon area. It's going
Okay,
here.
then perfect. That's.
I think
that's
it's
where
this
it is.
area.
Yep,
It's
yep,
in the artery, I see.
Oh, look at that.
See, that's the fourth compartment. Stay there. Or let me just move the depth. Here, I think we're gonna see here. This one. This is the color flow. Let's find out over there. Oh, here I see. Cursor. Posterior interosseous artery is here. So the nerve is going to be here next to that, right?
Yeah. And it's
Very good. I hope that everybody agrees. Yeah. Because when Divas practice, maybe we all agree.
if I move faster, then.
Yeah, can you move a little faster?
Yeah, so I'm gonna go
I
up
see
now.
here actually.
Yeah, it actually does. Yeah, it does follow what we're talking about. Exactly, it does what this.
Here.
Yep.
Yeah, let me try to straighten my wrist.
Okay. Now your turn.
Okay, now Divas is going to practice.
Let me just. Could you give us some towels from there?
Oh, good.
Oh,
Oh, yeah. Maybe you want to try this one?
It's more.
This is more hyper.
Yeah, here might be. Oh, on me actually it could be.
Yeah, you are smaller
Yeah.
than Divas. We can go back and forth, right?
Yeah.
Now your turn. Actually, we are taking a shower twice this morning. One with gel.
Do you want to start from above or?
Yeah, he can start because last time he didn't practice.
Then I will need another couple of towels.
Towel is, do you want to open the drawer? There is a pigeon gown at least.
Oh, that'd be great.
What?
To the drawer underneath. Yeah.
I didn't finish our
You on call last night? Oh, you were supposed to go home, right? Not yet. Not yet.
No, I'm all day.
Okay.
Oh, right.
So while they're preparing, last night when I upload my PowerPoint, you know, my recording was funny because my
Will this be enough?
PowerPoint didn't
here
behave.
I'm not sure. We'll see. Generally, here. I think it will be.
Yeah.
But here, I don't know.
I think let's then start. Whatever you want to try. You
Let's
want
try
to
this one.
artistic? Okay. Artistic is very good for the small one. So high. So device is gonna start from the axillary artery area. You know, come yeah. So let's start like this. I'm gonna change the depth a little bit.
Here.
Yeah.
I'm gonna change the
Yep.
here, and then color flow.
Ah, look at that.
Oh my goodness. Hers are very proximal. Okay. Then I'm gonna get rid of that. I think can you flip over so people won't confuse the direction? Yeah. We're gonna use the same direction because otherwise everybody will confuse. So axillary artery. Okay. Her case is
No, I see the median. I see the
so
ulnar.
I'm gonna do it.
The
Cursor.
radial.
Your axillary artery is this one. And median nerve,
Yeah, that thing. I
this
think.
one. Ulnar nerve, this one. But why
Oh.
we cannot see well? That's interesting. Here, it's good. Ulnar nerve here. Radial nerve supposedly underneath of the axillary artery, right?
Yeah.
A third part of the axillary artery. Therefore, it's hard to see, but it looks like hers are very looking good. And this is all. There are several axillary veins here. So if you move, can you show conjoint? Oh, this is the widest nerve is in the body, muscular cutaneous nerve, right? And then this is the fascial line. Can you? Yeah, good. Now he shows the fascial line better. Above is the short head of the biceps. Underneath is coracobrachialis. And this is the conjoint tendon, which is the teres major and latissimus dorsi. I showed that a peak drawing, right?
Yeah.
How it insert. And then now you're gonna go to the posterior part to the radial, follow the radial nerve. Slowly move from there. Radial nerve is moving, I see here. It's gonna be hard for us to go to the posterior part.
Oh yeah, I see it.
Here,
Yeah,
now
yes,
you guys can see radial nerve is coming through the per se posterior triangular interval, right? And it's moving to the spiral groove. Okay, let's continue go to the spiral groove. Oh, look at this radial nerve, beautiful radial nerve between the long head and medial head. And then going to the medial to lateral head, right? In between medial head and lateral head. This is the spiral groove. Let's take a look where he is. Look at this, his transducer is in the middle of the
Humerus.
arm, right? Humerus, middle of the humerus, sorry. Same thing.
That's fine.
We are speaking same thing. So this radial nerve is going to be on the bone, which is spiral groove, continuously come down to, when you come down, the radial nerve is going to move to the anterior part.
You might benefit from watch
All my resident fellow doctors is going to be better than me. Okay.
Well, that's how it should be, theoretically. That's how it should be, theoretically.
I know. But we found it here, radial nerve. Let's follow the radial nerve. Move here, moving already, going into the spiral groove. Okay, now continuously follow that one. Move transducer to the elbow area. And then now look at this. Move. See? It's moving over here. I'm following with the divas. Come move down. That this area come here. Stop. Can you toggle a little bit, show better nerve? You just showed a very good one. Let's say we stop here. Whoopsie dipsy. Oh my. I cannot get to the good one. Let's say if we do this one. Yeah. So here, this is going to be medial head and lateral head. You can see the dividing these two muscles, right? And the radial nerve is on the top of the bone,
Yeah.
on the spinal group. It's very clearly between the medial and lateral head of the triceps. Okay, now we're going to continue, unfreeze. Let's go there. Now, good. Divas is doing great job. Okay, let's follow the cursor. Where's my cursor? Okay, now move to the coming. So look at the Divas transducer. He's in the biceps. This is the triceps. This is the biceps. Now it's moving to the front part. So already you start to see the radial nerve sitting here. He moved his transducer. It's in the brachialis and brachioradialis start from here. It's not familiar from my toe, the triangle part. Now he's going to move his transducer distally to the elbow joint. Let's go to our home base. And then now you're going to do supinate.
Enjoy.
Okay, show me the trochlea and capital. Perfect. So now Divas is able to come to elbow joint, our home base, make it better. And so here, whoopsie dipsy, I'm a little impulsive. Capitulum, right? And then the V shape is the trochlea. And then this is the whole thing's brachialis. Still elbow joint, you see brachialis. Still brachialis didn't finish yet. And then he's going to the medial side. You can see medial nerve here. If you go to the medial side, can you show? To here. So this is above, which is the medial epicondyle here. This is the pronator starting point. You can see brachial artery, and this is the medial nerve. And then scroll down to, slowly come down. Scroll down to more below the elbow. You can see medial nerve here. Now move to the radial side. Move to the radial side. You can see radial nerve here, right? This one plane, you can see both. See here. I'm going to stop here, freeze. Look at this. This is the brachial artery. This is medial nerve. These things are pronator teres. This whole thing's above the humerus. This pyramidal shape is the brachialis, right?
It's the bicep tendon, I guess.
Biceps tendon is
The
this
white
one.
thing,
This is
yeah.
the biceps tendon. Bingo. And then we're going to move to the radial side. And this is whole brachioradialis. And then radial nerve. But this one, you can see the fascia line. Actually, radial nerve going into the brachialis here. You can see it. This is the extensor carpi radialis longus brevis.
Yeah, actually on me,
Can you see one?
some
Yeah.
muscles.
So you can see fascia line, this one, and
Yeah.
EDC starts from here. Okay, we're gonna move. It was now your turn. You can explain to us. Now, which one do you wanna follow? Superficial or
Yeah,
deeper?
we'll do superficial.
Superficial, yeah, that was fun, right? Let's go superficial. Superficial, this one, right? This
Yeah.
one? Okay, continue. Here, here, here. I'm kind of losing it here. It's hard.
But that can,
Where did it go? It's too big.
anterior, right?
Yeah, no.
Oh,
It
it's
should
too
be
big. That cannot
like
be.
Here.
Because I kind of lost it.
Almost on the bone.
Okay. Let's make it better.
Okay.
This is the superficial one, right? This one. Can you make it better? I don't know. Here, too, right? So this one. But yeah, let's go. Go, go, go too fast. Okay, go. It's very deeper. It looks like a deeper branch, right? It's going into those.
Yeah.
Yeah. You see, because you lost it. This is the ECRL, right?
Yeah.
Then you lose the brachioradialis. The superficial branch goes between the brachioradialis and ECRL.
Okay.
So, but now you went actually deeper branches. Yeah, because it has to go to the posterior part.
Yeah.
But we
Okay.
were having troubles finding it when Joe and I were scanning my superficial one, so I might be just crooked.
Maybe you
I'm
don't
just
have
saying.
one.
Yeah, I might be just, you know.
Okay, so this is
Actually, as I showed yesterday, my median nerve is like in the different place. It's not in the medial side. You know, I felt like I got confused. I scanned a million times, but it was median nerve.
That's why
Okay.
you're so good with injections. Maybe it helps.
Maybe. Okay, now we are following here, here. So don't lose this one. This is the, stay there. This is the brachialis, ECRL. So here, okay, continue. Here.
Yep.
Let's go to the deeper branch again. We have to go like here, like this. See? Because think
Oh,
about the
super,
brachioradialis is like this, right? But
Yeah.
you keep going this way, so
Okay.
they
Right,
go
yeah.
to deeper branch.
deep branch.
Okay, let's start from home base again. Can you guys understand what we are talking about? Because you have to follow the brachioradialis
Yeah.
direction, okay? Okay, let's find out the superficial branch. Here, going, this is the brachioradialis. You have to follow brachioradialis continuously. Brachioradialis. I think we lost it. Here? Oh, here. Can you go back? Here. Now you're gonna follow these two muscles, ECRL, ECRL, go fast. That's weird.
Is it up there?
It shouldn't be this one, it should be between here. This is the brachioradialis, this is the ECRL. So it should be around here. Can you move continuously in between so we can find out? Maybe the, whereas the nerve is so
Just
small.
So it's in the center.
Mhm.
Yeah, position the nerve in the center, the whole thing, so you can follow.
Follow. But some, maybe, you know, because radial nerve has 1 to 3 branches, maybe our superficial branch was the wrong one. Maybe this one, this one.
And now try to move down.
No, you become deeper. So your superficial branch is higher, I think, higher than what he follows. Because it continuously becomes. Let's go to home base to find the superficial branch. Can you toggle a little bit and clear which one is superficial branch? I feel like these all things are deeper branch. It's going to be not deep branch, but you know, nerve to the brachioradialis, ECR, ECLB. That's
Yeah.
what we are seeing
Yeah.
without seeing the superficial branch.
Go up here and see from where it comes.
Where are you?
Like above.
You are still in the brachialis and brachioradialis, okay,
Yeah.
above the elbow. Let's go down to elbow joint. Elbow joint. Elbow joint here. And then we are following this one, right?
Yeah.
Between the brachialis and ECRL, but let's follow this one continuously. This one. This one. Okay. Come down in between. Looks like now you are better.
Yeah, now it stays
Stay
out.
here.
It also dives deep, right?
Oh, it's still going too deep.
Yeah, that's what. That's what
Maybe she
Gemini
doesn't have
said.
a superficial branch.
But I do have sensation.
You do? Do you
Yeah.
feel it?
Yeah.
Oh no. Oh, hold on a second.
The first
Can you-
3.5 fingers.
it has to be around here. Can you continuously move down? Maybe this is the one, this one. That's weird. And then can you maybe wiggle continuously brachioradially?
Maybe it's on top already. That one.
This is the-
I think.
This is about in the top. There's a, oh, here, can you? Here, can you stay here?
It feels like it's this thing
Yeah.
because when you.
I
press
was
on
thinking this is the one. This one. Look at that. Okay, move. Going up.
it. Yeah, could be too.
Good. See?
Yeah.
Oh,
Something's moving.
Here. This one. This area. Go downstairs continuously distally. And then go to the. See? Continuously moving. To go to the your first snuff box. In between the first and second.
Yeah, it's hard there.
Oh, but I think Radial Nerve is the most difficult one.
Yeah. Now I can put Doppler, right?
Yeah, the cephalic artery.
Before-
Usually, in the when it comes to the superficial
Wait,
area,
not before. Colorful? This one.
when the superficial branch comes out the subcutaneous area, cephalic artery is cross over the radial nerve, superficial branch. So where is
So
it?
we're at snuff box, and this is my.
You have to find out the wristers, which first and second one. Here, oh, it's very hard. Let's go. Can you bend it a little bit? Let's get rid of the flow first. Here. This is going to be the one. So, has to be so small. So small. Ay, 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 ay.
All right, let's
Hey,
do
what's
the.
the deepest? Why
Let's
don't you
do
put
the-
on your wrist?
Let's do. Or maybe the deep one, just because
do
of
the
the
deep
time.
one.
Oh yeah, find out the
because
deeper.
it's like 7:48.
Already?
Yeah.
Oh my goodness, today is the Radial Nerve Day then.
But we did well. Like I did it, and now Davis is gonna do it.
Hmm?
But I did it, you did it, I did, and Davis is gonna do it. That's perfect.
Yeah, we
I think that was a good size. It's a good size of material.
the male's nerve is much like bigger than our nerve. Okay, let's
Yeah.
practice deeper branch. Maybe three of us will practice a little more about the superficial branch because we all different.
Yeah.
But Divas was the best superficial one. Okay.
Yeah.
Now already you passed the arcade of crochet. I'm gonna make it deeper. Let's go. Maybe Vera is gonna be the one who's gonna find the arcade of crochet.
Here we go. Oh,
Not yet.
wait, this one.
You have to go back approximately. Right, that's the point, right? Yep, and then coming in. Now coming in. Okay,
Yeah.
see here we go.
Here.
Ta-da! Right. Okay, now let's look for the exiting part. For you to see it, you have to go posteriorly. Good. Posteriorly and distally. See now moving more distally. more because you have to make the EDC as a square shape. See, now it becomes square. It's exiting. Radial nerve is exited, right? And then now
So
that's the
is
little.
that's the supinator going away.
Yeah, you can see going away now, almost gone, going away, or distally, still gone, right? Now EPL popped out already,
Keep this one.
and then her various cases very not easy to deeper branch, but here you can see deep branch here, yeah.
Neither of the branches are easy on me.
And then move back and forth to look for the posterior interosseous nerve going into the posterior interosseous membrane. So this time you have
Here
to.
goes.
Oh,
I think.
so you have to move fast, scan slowly, not too fast, but when you move, scan fast, you can see posterior nerve better. That's the kind of facial line, right? Along the facial line is gonna
There is
move.
something white that's moving.
Yeah.
I think it's. I want to say that's down, but.
Oh,
What
I
are
think
they
it's
seeing?
there, yeah. I think this is the one. This is the one.
Mhm.
It's coming into the posterior interosseous membrane and go continuously downstairs to the wrist joint. Okay. So at least you guys now know how to scan the radial nerve, right? So there is a couple of points we have to, because I'm a pediatric physiatrist, so to me, extensor muscle is important when the patient comes with fisted hand, like this. And then wrist is extended but finger is flexed. So in this case, well, due to spasticity or dystonia, in this case, I usually do extensor carpi radialis and then drop the wrist. Then you can easily open the fingers. That's why instead of doing finger flexors, if the patient has tenodesis, exaggerated tenodesis with the finger flexion posture, then I do the wrist extensor, drop the wrist, and then finger can be easily opened. But even after you drop the wrist, if finger is still very flexed, then you should do FDS, FDP together. Do you have any questions about the scanning today?
Yeah.
And then once again, for the sports medicine doctors, maybe a spinal groove. You know, when you have a accident, you can have fracture in the spinal groove. Oh, you just saw it? Go up and down here.
Yep. Here. Over here. There.
Because he's going upstairs now. You
Yeah.
can see supinator is popping out, radial nerve. Now you can just dreaming about the radial nerve while you're sleeping. So hopefully everybody can understand the radial nerve pathway from the axillary artery, triangular interval, spiral groove, supinator, and then I think that's it, right? And then first between the first and second compartment,
Yeah.
and the fourth compartment is going to be deeper branch. Hopefully you guys had fun, and then we'll
Lower
come
extremity?
next week. Next week we're gonna start the low limb ultrasound, right? So we're gonna do low limb muscles, and then hopefully some sciatic nerve, or yeah, maybe sciatic nerve and tibial nerve or something like that. So thank you so much. Have a wonderful day, and bye bye.
Happy Monday.
Yeah, that's true. Happy Monday.